The pandemic, public safety, and the weakening of reproductive rights are all drivers of anxiety. Is the struggle never ending?
Now we are facing a new series of booster shots, and the question I get all the time is, when is this going to end?
We've seen a massive increase in people picking up a gun and using a gun in the community. We've seen increases in road rage, so I think that is a pandemic issue.
We're no longer on the slippery slope. We're tumbling down the mountain. Maybe we've been pushed off the cliff when it comes to what are the rights can be taken away.
That's next on Seattle University Conversations. Now your host, Professor Larry Hubble.
So, welcome to Seattle University's Conversation Series. Tonight, our topic is anxiety overload, coping with the pandemic, public safety, and declining women's rights. And we have as our guests three very distinguished guests who are very knowledgeable on their subjects. Dr. Vin Gupta, public health physician and health policy expert, and also frequent commentator on NBC. Our new Seattle Police Chief, Adrian Diaz, and Seattle City Council member, Sarah Nelson. And thank you all for showing up tonight. We really appreciate it. Given the awful air we have right now, it's nice that you ventured out. So, let me just start off with Dr. Gupta. In planning this event, we identified a few clear sources of anxiety that people feel. There are obviously many. We picked three. Two others I think of one is high inflation and more, in a broader sense, global warming. But we picked these three. So I'd like to start off with you, Dr. Gupta, and I'd like to ask you, given the lessening of the pandemic, what continuing precautions should we take now?
Well, first of all, thank you for having me. It's truly a privilege to be here with such distinguished panelists and to be at Seattle University. So, Dr. Hubble, thank you. In terms of where we stand right now with the pandemic and the anxiety that I think all of us, probably to some degree, have felt over the last 2.5 years, I think at the root of it, and I'm sure Councilwoman Nelson and Chief Diaz will be talking about some riffs on the same theme, a lot of it has been driven, and I've contributed to this industry, the media industry, a lot of it is driven by how we intake information, how we're provided it. So whether it's social media or whether it's cable TV, there is an absolutist tendency to the information that gets and the message that gets sent out on either platform. And so it's one way or the other. 24% of the country thinks COVID-19 is a hoax. It doesn't even exist. The other 75%, I'm assuming, potentially might have had at least one shot of the vaccine. But it's a dichotomy. And to get a calm, rational message out there that doesn't speak to one side or the other, that I think might actually represent reality, is difficult. And as a result, you have that sensationalistic way in which information is communicated. That is driving anxiety, in my opinion. I hear it from my patients, from their family members, that they saw X, Y, or Z in the Twitter sphere or on Instagram or on Facebook, or they heard it on their preferred cable news channel. That is driving this. And it becomes harder and harder to actually land a message that it's not going to get clicks. Because at the end of the day, to answer your question, it's a long-winded way of coming back to your question. To answer your question, I suspect now we are facing a new series of booster shots. And the question I get all the time is, when is this going to end? And the reality is Omicron has finally wrought a dose of reality and a pill that we've all had to ingest from the very beginning. I and some of my colleagues have been saying from the very beginning that you get vaccinated against a contagious respiratory virus, whether it's flu or maybe RSV down the road, not to prevent mild symptoms or a positive test, but hopefully to reduce your risk of ending up in the hospital. Turns out Omicron has rendered the vaccines about as effective as the flu vaccine. And so you don't hear that on TV, or you don't hear that coming out of the administration, because it's a very different message from the message that was being given in May of 2021, which is from the CDC director, and I'm not trying to criticize anybody, but if you get vaccinated, take off your mask, there's no chance of transmission. Because everything is so absolutist in the media cycle, as also encouraged by our leading federal health officials, I mean, they put these tidbits out there. There's no nuance out there, but the nuance, frankly, is the vaccine, the bivalent vaccine at best will reduce your risk of ending up in the hospital, maybe 50, 60%, and that it's only going to be good for a specific window of time, 4 to 6 months. And so in many ways, we're headed toward that exact paradigm of why you get a flu shot. Mid-October is a quick PSA, good time to get a flu shot. But you get a flu shot to rev up your protection between November and the end of February. And at most, it reduces in a good year your chance of ending up seeing me in a hospital by about 50%. That's a good year. And the truth is, that's probably where we're headed with the bivalent vaccine for Omicron and whatever comes down the road in 2023, so on and so forth. That is a middle of the road, I would like to think, fairly evidence-based assessment, and I'd also like to think calm assessment that's probably not going to get a lot of clicks on Twitter. It's probably not going to have a lot of resonance in the public sphere, and it's not going to be something you hear coming from the White House podium, but it's the truth.
Thank you. Chief Diaz, many people fear for their personal safety on Seattle streets. How rational is that fear?
You know, honestly, you can't, for me, it's really not addressing people's fear. I think everybody is going to have different emotions to what is going on. When they walk out their door, are they going to see graffiti? Are they going to see people that are in crisis? Are they going to feel that sense of safety or not? And I'm not going to tell them to not feel that fear. Because honestly, that raises a little bit of that vigilance and making sure that you can be able to respond to any issue that might come about. Really, as we look at the pandemic, prior to the pandemic, we were seeing our crime increase, partly because we were at a 25-year low in crime. I mean, our homicides at the lowest point in just about 5-6 years ago was around 26. We had not seen crime that low. And so we did start to see this uptick in around 2018 and 2019. We were around 35, 36 homicides. And really what I focus on is a lot of the violent crime, because that is something that is very difficult to not report. When you look at property crime, you look at burglaries, car prowls, thefts, some people will be like, oh, what are the police going to do, and I'm not going to report it. And so it's very hard to create that determination when it comes to property crime. But when it comes to violent crime, homicides, robberies, sexual assaults, typically you have a higher percentage of people reporting those crimes. And so when I look at those elements, we are seeing that uptick in crime. In fact, aggravated assaults, shots fired, have gone through the roof. We were about in 2020, we were about 421 shots fired. This year, we've already surpassed 620. So we've seen a massive increase in people picking up a gun and using a gun in the community. We've seen increases in road rage. So I think that is a pandemic issue. I've never seen anxiety. I mean, I've never seen people literally pick up a gun and do a lot more shootings in regards to road rage. We're seeing, domestic violence increase, shootings in regards to domestic violence. That's people literally being stuck in a house together, or an apartment, or some sort of dwelling together in a confined location all the time. And so those are very big concerns for us. But we're also seeing it. Most of our shootings are related to having some level of homeless nexus. Almost a third of our shootings are related to homeless nexus. So we have a lot more unsheltered population, and we also have people that are experiencing not only behavioral crisis, but we're also seeing this uptick in the use of fentanyl. And fentanyl has really plagued our community. 5 years ago, we recovered about 400 pills in the entire city. This year alone, we've had over 1 million. And so, one pill can actually kill somebody. So think about how many, if we recovered over 1 million pills, that's enough to kill this entire city. And we're seeing this just massive increase because people are coping with the stresses of what they're experiencing in life, sometimes in the use of drugs. And so this is where that's where I feel like it's hard for me to tell somebody don't feel that anxiety to what, potential crime. It's figuring out how do we actually deal with the trauma and how do we actually deal with the anxiety? How do we actually figure out coping mechanisms to be able to address that issue?
Now, it's no secret that Seattle has a dramatic shortage of police officers. Doesn't that shortage have a significant impact on people's perception of public safety?
Oh, for sure. I mean, I've lost 485 officers over the last 2.5 years. And that is equivalent of what our patrol force is. So imagine a police department that actually has no officers patrolling the streets. That is a massive amount. And so what we've had to do, we've had to make, big scale adjustments. I had to put officers back into patrol. I had to get rid of all the specialty units that we had and really be able to just focus our efforts on 911 call response. It doesn't allow us to really do the problem solving that we had once done before. But what it is it's also an opportunity to change the way we look at how we do policing. So instead of going from a specialized department, it's allowed me to really focus on becoming more of a generalist. So having an officer be able to do anything from community outreach to being able to respond to that active shooter. So it streamlined all of our work and our efforts. However, when it comes to priority 3 calls, so the burglary and car prowls, it's taken a step back. And so people aren't getting that same response of, where an officer comes out to take a report and be able to collect evidence. That's taken a lot longer. It's taken over an hour. So people have that, then feel like, well, the police are not actually being responsive to the needs that I've got. And so that is that's where you feel that fear start to be effective. And so that's the reason why it's so important for us to have at least the amount of staffing that we've determined is a safe level of staffing. And I've said that at about 1,400 officers is what is needed for this city in the next several years.
Councilmember Nelson, did you also want to respond to that, or?
It gives the perception that there isn't backup. That the safety net is fraying. That's what I will say.
Okay.
Yeah.
Now, as a PhD, earlier in your career, you taught courses in women's studies. So I'd like to ask you something in relation to declining women's rights. Many women are particularly worried about losing reproductive health care rights. How much do you think that contributes to an unsettled mind in the mind of many women?
Well, it's not like we didn't have anything else to worry about in the age of COVID, right? I mean, so now look, I have a PhD in cultural anthropology, and I did teach women's studies courses, and I'm very aware of one's subject position and how it impacts the way one sees the world. So as a white, middle-class, middle-aged woman with insurance, I can say that I don't speak for everybody, but I think the better description of how that has impacted the women that I interact with is outrage. Outrage. It's so, and we're all afraid with the ongoing pandemic, feelings of uncertainty about, everything is from, are the kids going to be able to go to school? What's happening with my job, etc.? How are my elderly family members doing, etc.? So all of that on top of having a fundamental right be taken away by the Supreme Court. And so that adds to feelings of anxiety, outrage, betrayal, all of what I've just said. Now, I do have to make a note and say that in Washington, we do have access to abortion still, and it's codified into law by Initiative 120 that passed in 1990. And I have to say that I came to Seattle in 1990 to start graduate school at the University of Washington in anthropology, and I volunteered on this campaign. And so I did come prepared to say what the status of abortion is right now in Washington. That law did codify. Let's see, it reads, gosh, I might not be able to find it now. The state may or may not deny or interfere with a woman's right to choose to have an abortion prior to viability of the fetus or to protect her life or health. So that's good news, right? But there are people maybe in this auditorium that live in other states where they will not have access to abortion. There are people that live in other countries that are here that have been denied it all along, and so this will impact Washington. it will impact Seattle, because we are there was a suite of 4 pieces of legislation that were recently passed establishing Seattle as a sanctuary city for abortion, and also around basically prohibiting the prosecution of women and practitioners here who are performing abortion on people from other states. So we are trying to extend access to people that come from other states to seek an abortion. And this is going to impact the healthcare system of people in Washington. It's going to the clinics are going to fill up even more, because abortion clinics also provide primary care and all other sorts of reproductive health services. So I'm just saying that it raises to a fever pitch the feeling that things are not normal. And so I think that there is a nexus between the pandemic and the decision in terms of how it makes women's anxiety increase, and also just men too. I mean, let's face it, we're all in this together, right? I mean, you make a baby with 2. So in fact, it will impact the lives of everyone.
Thank you. Dr. Gupta, a government task force has recently recommended that adults under the age of 65 should be screened for anxiety. Another task force urged that people ages 8 to 18 be similarly screened. Now, I know this is not your exact field, but what actions do you think, would you tell us that we should take, if any, regarding anxiety and its control?
Well, I just want to follow up real quick. I'm going to get to that question on what the councilwoman said with respect to Seattle being a sanctuary city for practitioners, in addition to being able to get access to abortion. That is critical. I think Gavin Newsom at the state level California was the first state to inculcate that. If anybody wanted to come to the state of California and get an abortion, practitioners critically would be protected or indemnified from prosecution if that patient, say, came from a state like Idaho or you name it, where where it's outlawed. And that is critical, because if somebody's coming from out of state and they need a follow-up visit, or there's a complication, it is very easy to point fingers and say, well, then why did this practitioner in the city of Seattle do what they did? And so medical legal, which undermines, in my opinion, the ability of our healthcare to reach its potential, of our healthcare system to actually truly be a healthcare system that works for all of us in this room. It's the medical legal ramifications of some of these policies that actually result in the city of Seattle having to make sure that practitioners are protected. If that policy was not pursued, it wouldn't really matter if you could get access to an abortion here in the city of Seattle. You needed that overarching protection for providers because of how broken our medical legal system is. So I just want to emphasize that, and thank you for your leadership on this issue. When it comes to anxiety, at the end of the day, I think life is about coping. We're all going to have ups and downs, and there has been a lot of debate about, for those who may have seen the United States Preventive Task Force, they issued a guideline that anybody 8 and over should be screened for anxiety. The defendants of that, and they're all clinicians that are looking at the evidence, are saying early intervention in a society where anxiety seems to be the norm, where delayed diagnosis results in depression and anxiety as an adult's decreased performance, depending on how you measure that early intervention can be helpful. There's the con of it, though, that are we medicalizing everything? And there is that skepticism here, that does this need to actually be something that you have to treat then with a pharmacotherapy? Because now when we talk about screen diagnosis for something that some folks say is a normal part of life, that we deal with ups and downs, there's got to be a balance here, because the more you medicalize, the more you say we have to give an ICD-10 code, diagnose a child that's 10 years of age with anxiety disorder. There are downstream implications with that. So I do think we have to be thoughtful here. That is also to say that we can't come out with a screening recommendation unless our healthcare system then has the requisite resources to meet the need. And I hear this from patients, from parents. I'm married to a pediatrician. We have 2 young boys. We hear often about the mental health crisis amongst adolescents, amongst children. And it's rising. The pandemic worsened it. It turns out there aren't mental health professionals in the requisite numbers to meet that demand. So if we're going to say you're going to screen, you're going to diagnose, then where's the supply of mental health professionals to meet the need? We still don't have that.
Thank you. Chief Diaz, police deal with a whole range of mental health issues on the street. What training do your officers receive to handle the mental illness element of a street disorder?
Yeah, so every year, so we actually have officers that are what they call crisis intervention trained, so they spend 40 hours worth of training. We also have advanced CIT training, and it's taught in a mixture between police and mental health professionals. That's another 40 hours worth of training. Every year, as part of the State Academy, there is another 2-hour training that is conducted on mental health and de-escalation. And then we also do in-service training that is focused on de-escalation at every level of skill set that we do. So de-escalation is incorporated in every aspect of our training. So there is quite a bit of training. In fact, when it comes to dealing with people in crisis and mental health, prior to the consent decree, we were, I think the consent decree noted that there was about 66% of people that we were dealing with crisis resulted in some level of use of force. Now, about 1.5% of cases are resulting in a use of force. So we've drastically dropped the amount of use of force that we've been using in dealing with somebody in crisis. And obviously would love to be at 0 because, but many of these instances are they're very high profile, they're very critical because sometimes they're dealing with people might be armed with a knife or might be armed with a firearm. And so those are the cases that we do find ourselves sometimes having to use force. And it's unfortunate, but we are trying to find ways that we can limit that level of force. So we are actually implementing new tools. Probably in the coming month, we are going to be adding what we call a bolo wrap tool to us. It shoots out strings and it kind of wraps around the body. Early on, we've implemented taser, we've implemented other less lethal forms, because the whole idea is we want to make sure that when we go into a situation that life is the most important aspect, that we can try to preserve life. And then from that, you're trying to figure out all the solutions to be able to make that, to keep that goal happening. And then there are some cases that unfortunately have resulted in a death. And so, we're trying to make sure that we learn from those incidences and figure out ways that we can not have those happen.
Thank you. Before I ask my next question, I'd like to ask our student volunteers to collect the note cards from those of you in the audience who have a question. This is to Councilmember Nelson. The Supreme Court, as we've already mentioned, has overturned Roe v. Wade and thereby undermined the right to privacy established by that previous ruling. What additional rights related to women and privacy do you believe may be at risk?
Well, I think Justice Thomas gave us that answer. The comments associated with that decision, he put on the table explicitly gay marriage, contraception. So I would, we're no longer on the slippery slope. We're tumbling down the mountain. Maybe we've been pushed off the cliff when it comes to what are the rights can be taken away. So that's, I am not a legal scholar, so I am going to not say anything else that I'm not a specialist in, but I do think that is something that's on everybody's mind. Also in Washington, we did establish gay marriage as a right. And so these are things that go against the values of many people that live in Seattle. And we'll see what happens. May I respond to
Sure.
the question that you asked, Chief Diaz,
Yeah.
about people in crisis?
Uh-huh.
I have to ask myself, why are people in crisis? And so, and when we talk about going after root causes of violence, of social ills in general, I'm stuck on what was mentioned already, which is addiction, and and then the attendant misdemeanor crimes that might be committed to support an addiction, all the way to the gun violence that is associated with drug trade. But we are asking our first responders to respond to people who are in crisis for many reasons, and it's not just addiction, but I feel that we have to figure out a way that we can really do something to help people that are caught up in addiction and need to that want to give it up but just don't have access to that.
Mm-hmm. Thank you. Dr. Gupta, are we likely to have another pandemic in the near or long-term future?
Yes, I do think we will. I will say this, that I'm not going to say, I think near is relative. It doesn't mean next year or in the next 5 years, but I think in our collective lifetime, we're likely to see a respiratory virus that's going to cause something similar to what we saw in March of 2020. Yes, I do. Now, having said all that, we have tools that I think are still underutilized when it comes to our healthcare, our tools that are actually embedded in the home that did not exist in December of 2019, much less December of 2020. Over-the-counter diagnostics, telemedicine that is made more meaningful with remote monitoring devices like like your Fitbit or maybe an Apple Watch, whatever is your preference if you choose to use that technology. We're in a fundamentally different place now with our healthcare from a tool standpoint and the way in which it's now indexed. It's no longer provider-driven. It's patient-driven. I can't tell you how many of my patients, I'm wondering how, I'd love to see a show of hands for the room, although I know we're also on TV, of how many folks in this room feel like they could categorize themselves as low, medium, or high risk from a medical standpoint. I feel like I would be able to do that. I guess I'm a clinician, but I just from a lay understanding, I will say that the public is in a different place when it comes to understanding at scale their individual health, whether it's poor, whether it's good, whether they have to take extra precautions, and then we have tools that they can go and get without needing a doctor's prescription to make themselves healthy, or to keep themselves healthy, whether that's an over-the-counter diagnostic. Right now it's COVID. We're going to have COVID, flu, RSV before long. We'll have cholesterol tests in the at-home environment. You can go and you can triage with your chosen provider with a click of a button on your phone if you have access to a phone or a smartphone. It is a much more nimble healthcare system now than it was in December of 2019. We still need payment reform, but I think what our politics at a national level has been unable to do, technology is unlocking, and that's going to be helpful come the next pandemic. Assuredly, just to emphasize this point, epidemics of pandemic potential happen all the time. You hear every winter time in China, for example, which happens often to be a sink for some of these flus that pass from animal to human, especially influenza strains. One day there's going to be a flu strain that emerges from that part of the world, because that tends to be where the sinks are, and it might have pandemic potential. But we are better positioned now to deal with it than we were in December of 2019, no doubt.
And how are we better positioned, would you say?
Well,
primarily,
first of all of us are normed on what to do. I would venture a guess that if I told everybody right now it's critical that you need to wear an N95 because there's the next pandemic flu strain right outside the door, I would imagine that I'd be able to get some consensus in the room. So we're used to doing things that are necessary in the time of in the urgent part of a pandemic when things are still unknown. I think crisis communication from a health standpoint has also improved. Healthcare is not known, that industry of healthcare is not known for its nimbleness in a crisis. And we did not have a bench of leaders at the White House podium who knew how to message to the public. I think we overshared too many scientific details that were utterly meaningless in favor, instead of using clear communication, images on why you get vaccinated. I think we've learned those lessons, I hope. And now we actually have better strategies to crisis communicate. So we have better tools. People know what to do. Whether they'll do it, I think it depends on, can we effectively communicate? And oh, by the way, we have digital tools, and we have a series of tests, for example, that the FDA, that your insurance company now is, the FDA is allowing for at-home use, more tests in the at-home environment, and insurance companies are used to actually paying for it. 18 months ago, none of this stuff existed. And so I recognize that we're all tired of the pandemic, but if you take a moment and look at how much transformation has occurred as a result of it, it's a pretty important silver lining.
Thanks. This question I'd like to address to both to Chief Diaz and also Council Member Nelson. Prior to the pandemic, downtown Seattle was vibrant during the day and night. Now it is less so. How can the Seattle Police and the City Council contribute to restoring that vibrancy?
You know, it's a great question because, we just experienced, 12th and Jackson was pretty much a haven for a lot of criminal activity, anything from shootings to also trafficking of stolen goods. 3rd and Pine also resulted in many shootings as well as homicides that occurred in that specific district. And what we also saw was also, the use of drugs, the sales of drugs, as well as a lot of trafficking of stolen goods. And so, but that has also occurred over the course of my 25-year career. I spent, when I first came on in patrol, I spent it in downtown, and I saw what we experienced 25 years ago. And so the city hasn't changed in that 3rd and Pine corridor over that 25-year period. I think it's gotten a little worse because I think our staffing has been an issue. But one of the things that is so crucial, number one, we've seen that the presence can actually change, some of the behavior that's occurring in that area. So once we put an immense amount of police resources, we saw behavior change. But one of the things that we really struggle is we've lost a couple hundred businesses in that downtown core. People are boarding up businesses. So how do people feel safe to actually come in and do shopping? So there's a reluctance to actually, use that downtown and really come in and do shopping. You go to Bellevue, you see hundreds of people walking the streets trying to go into shops, and that's part of one of the issues that we have. So we have to be able to make it feel safe. We also have to have businesses open up and feel like they're comfortable doing business in Seattle. And we've got to get Amazon and all the other different providers that are having business, that have workers that are working from home, to be able to open up shop as well, so they can actually be able to help businesses thrive. Well, really, I've been discussing with a variety of different providers or a variety of different business organizations is about, what kind of incubator funds that can actually set up really small businesses and get people actually coming in and doing, or having little cafes and having little restaurants. So a lot of the, workers can come back and feel like they can, occupy a space, because once people occupy a space, it overall can actually make communities safe, and it actually reduces the need for police, presence. And so there's just a lot of things that we can do in working together with not only our business community, working with our residents, but it's really, one of the parts that we do have is we got to make sure that we're keeping areas safe as possible as well. So.
Well, I chair economic development, city light, and technology. That's my committee. And, but I would love to be working on neighborhood district revitalization and a lot of these other things, but public safety is foundational to our recovery. And when Chief Diaz was saying people feel afraid to come downtown and shop, also a lot of those stores that they would like to shop at are no longer there. So right now is budget season, and we are we've got the mayor's proposed budget, and it will depend on the investments that we keep or jettison in there. I think that there are ways that the city has tried to help. So for example, you mentioned boarded up doors and windows, that storefront repair grants that are now available for very small businesses. That's great. it's about $2 million, and a broken door costs a lot more than $2,000, but it is a start. So getting direct support to small businesses that are the least able to pay for those repairs is good, because it's not just good for the business owner, it's also good for the neighborhood. It's good for the neighborhood character. It makes the street feel more alive. But we need to think bigger than that. How about a concerted effort to recruit businesses to come to Seattle and to, especially along 3rd Avenue? What do we do with 3rd Avenue? It's a corridor that's needed help for a long time. So there are policy decisions that we need to make soon, and so yes, having a fully staffed police force is extremely necessary for public safety, but there are also things that we can do to incentivize businesses coming back.
Thanks. Dr. Gupta, in your view, what did policymakers like the presidents, the CDC, the Seattle mayor, the governor, and others, what do you think they did right during the last pandemic, during the current pandemic, and what did they do wrong?
Wow.
Broadly speaking.
We'll have a follow-up.
We only have a few minutes, but
I'll keep this brief. I will say that and this is a great question, because we're having it in Seattle. We had the first case of COVID-19 in this city. I remember being in the ICU at Virginia Mason in the middle of March of 2020, caring for sort of the first stream of patients coming in requiring ventilatory support. And one of the biggest and most important examples that was set by some of our leading employers here in the city of Seattle, or in the broader region. Microsoft, Amazon, other employers said, we're going to work from home. I recognize that that's working at counter purposes now to what the chief just said, that it has created a very different work environment. And yet, if you're asking me in a time of crisis where a lot was not known on a respiratory virus that was highly contagious, the single best thing that was done in that immediate moment of uncertainty was sending folks home. And that was not a decision necessarily made by the governor or the mayor at that time. It was made by large employers. They then followed suit a few weeks later, which was a great example. Clearly there was lags. So I think that was what was done really well. I will say across the board, we had clarity. We have clear tools. I say this as a pulmonologist on what works when it comes to public health messaging. Smoking is still one of the biggest killers, the number 2 killer worldwide of humanity. It's pretty sobering. 50 years, it's still the number 2 killer of humanity. And yet, in absolute terms, we're saving tens of millions every year. Actually, the percentage of people dying from smoking is still coming down, even though it's still the second leading cause or killer of death worldwide. What's the reason? And this is not my opinion. This has actually been studied, that effective messaging and visceral communication with just absolutely horrific images has had traction. And so the single greatest public health communication strategy that has ever existed, reducing the utilization of tobacco cigarettes, all those principles suddenly went out the door. Nobody remembered them when it came to how do we message to people clearly at scale on why you should do something like vaccinate. And we were litigating every last new manuscript, and it was causing confusion. And so that was and remains, to my points earlier, and now with this new booster, we are not hearing clear messaging. I'm not hearing it, and I think that's a problem.
Okay. Chief Diaz, what can you do now to protect people and lower their public safety worries now that you couldn't do when you were the interim police chief?
Well, I'm still interim chief until I have city council confirmation. So, but honestly, and I was very grateful that the deputy mayor recognized this and the mayor recognized this early on. When I became the interim chief, I wasn't going to lead this department as somebody as a caretaker. I really pushed our department to create innovative initiatives. We actually started running. I didn't want to wait like 2 years to get data back to say that we might be doing bias policing. So I created a program in real time called the Equity, Accountability, and Quality. I also, added that with my relational policing initiative called SPD Before the Badge, and a really front end work on kind of an officer wellness piece, but really honestly developing officer skill sets at the very front end of a recruit's career to understand social emotional learning and brain development and trauma informed practices. And we had not ever done that before. And then I also then have revamped our early intervention system and using a tool that we had not done before, but a machine learning tool, so we can actually be able to identify when officers are prone to being potential issues that they might end up arising, where it could create a complaint or a lawsuit. And so right on the front end, I wanted to make sure that our department was moving forward on stuff that we had never done before. And then we did see a significant reduction in staffing. So I had to move specialty units back into patrol. So every aspect of what I have done has really tried to make sure that we were able to keep our police force going, that we were able to still respond to 911, and that we're also still being able to be responsive to addressing the overall crime. Losing the amount of officers that we have and seeing, yes, we have seen a rise in violent crime, but our officers have done a good job of really, getting to work, and they're actually solving cases. They're actually making good arrests and actually prosecuting on a lot of these cases. So, like now, as we start to then build it, really one of the biggest issues that I've got to deal with is our officer wellness. Because our officers are working double shifts to try and make sure that our staffing is adequate, we really have to make sure that we're investing in their own health and well-being, because we know if a healthy officer will create healthier outcomes on the street. When they're stressed out, when they're overloaded with all the work, when they're only responding to people that are, in crisis or in shootings, it's a recipe for disaster for their long-term health. And so I have psychologists that are actually inside the precincts. I've actually have officer wellness dogs. I've built an officer wellness unit made up and comprised of not only a mental health specialist as well as officers. So we're creating those investments early on, and there's more that we need to do. And so actually, as we get into the next year's budget cycle, some of the things that we're doing is I need an executive level position that's really focused on kind of a clinical psychologist that can help me, really revamp the way we're doing wellness and kind of really prepare us for the future. And so I think as I take the helm, those are the kind of things that I'm really doing, is making sure that our department is a healthy department, that we're responsive to community needs, and that we're addressing overall crime.
Thanks. I think I have time for one more question before we go to a break, and I'd like to ask that of Councilmember Nelson. It seems that women's advocates have largely been playing defense recently. Does the country need something like a civil rights movement for women? And if so, what would such a movement look like?
Wow, what a question to end on. So women still make, I think the number now is 78 cents per dollar compared to men. Generally tend to, I'm not going to go down that road because it's a generalization, frankly. And different women struggle with different things depending on their class position, their racial identity, whatever. And so it's very difficult to say we need a new civil rights movement for women. I think, getting the law past the Senate that would codify abortion nationally, that would be a good start for this one particular issue that you started asking me about. But in general, I believe that it is, that we can't say what the new movement should be because it's all local. And I am a city council member because I believe that this is where change happens. And so this is, I am focused on what we can do right now to advance equity and access to jobs and to better education and to the opportunity to improve one's community.
Okay. I guess I have time for one more question. I'd like to address this to Dr. Gupta and also Councilmember Nelson. Quite unexpectedly, I think in most people's minds, certainly mine, certain behaviors during the pandemic became highly politicized, namely wearing masks and getting vaccinated. I wonder if you have any suggestions regarding how pandemics in the future can become more of a public health issue and less of a political issue?
I think it starts with setting the right expectations. And we're playing from behind here, of course, because there's been a lot of damage done. We don't have an institution at the federal level, or frankly at the global level, WHO or CDC, FDA, that is trusted. I would even say colleagues in public health and clinical medicine that I work with that really believe in those institutions roll their eyes whenever a message gets put out. So, truly, it comes down to building back that trust through better practices in crisis communication for the next pandemic. And I think we're going to have hopefully some traction there so we can expectation set properly that vaccines, for example, for whatever we face down the road, whatever gets developed, are imperfect. They're imperfect solutions, but they're good. And that has to be the message. Masks, there is no good. My sense here is over time, the issue of masks, once hopefully we have a respite from this pandemic, I do think that things are going to start to normalize, that we're not going to see a winter surge on the likes of 2020 and 2021, that hopefully we'll have a few years to really feel like we have a breather. That COVID flu season in 2023 is not going to look as bad as it did in 2022. Things will peter out. So we'll have a few years, hopefully, to wash out some of the silliness and the nonsense. What I do think is critical is that in addition to better tests and some of these tools I mentioned earlier that we now have at our disposal very easily, that we have better masks that are more comfortable, that people are more willing to put on. And that technology is actually being developed as we speak. That we have a better evidence base about what masks actually do so that we can clearly communicate. If you remember, there was a lot of hemming and hawing in the early days, not of only the vaccine rollout, but of also what do masks actually do? Do they protect the user? Do they protect the person next to you? We need a better evidence base. Frankly, I think we need more comfortable masks. We're improving there, but more comfortable, reusable masks so that it becomes less contentious. It's not going to be entirely eliminated.
When you were talking, the answer to your first question, talking about the effectiveness of vaccines and what that might mean the pandemic means going forward, in my mind, I was thinking, I wish I could talk to that guy for about an hour because I wonder what the implications are for policymakers. We're about to end our state of emergency. The mayor announced that last week. The governor announced that. What does that mean for a city council member like me when it comes to rules that we're following on just within City Hall, etc.? So I feel that I am not the best person to speak to the politics around masking and not masking because I do live in Seattle and I don't encounter that tension as much as some people might living elsewhere, or the people that are on the front line serving folks that might not live in Seattle. But I do think that it does raise questions about how we go forward, knowing that this pandemic will change again, and we do have the tools now. Some of the tools, we're more prepared than we were. We turned on a dime as a city, set up testing sites and then vaccination sites. I have to hand it to our fire department. But we're learning together, and it's about tolerance. And for me personally, showing up at City Hall every day to be there to listen and to show that we can be in this together safely.
Okay, we're going to take a very short break right now, and I'm going to collect the questions that the audience has, and we'll be coming back in a few minutes. This is for both Dr. Gupta and Council Member Nelson. The person asks, I am very anxious about the demolishing of Roe v. Wade. This is not just about women. Do you support a federal law, as Biden has indicated, that would make abortion a legally protected right? How do we make this law SCOTUS-proof, meaning the Supreme Court, so we don't endure the havoc of the Dobbs decision?
Yes. That is my answer. And Patty Murray, our senior senator, is a champion of that legislation, and of course also Senator Cantwell. So SCOTUS proof, again, I'm not going to get into the realm of legal theory, but I do support that. One more thing, because I always think of my best lines afterwards. The best thing that policymakers can do going forward with the pandemic is follow the science. That is clearly the best thing that we can do, and so I'm looking at I'm looking to folks like Dr. Gupa to help policymakers lead the way.
I of course agree with the Councilwoman and her sentiments. I would just add that, again, to bring it to resilience and the future of healthcare that we're living in right now, there are interesting solutions now out there for somebody that lives in a state. Let's imagine the world as it is today. There are solutions that exist in the digital space where there's a company called KindBody. I have no conflicts with this organization, but what they do is they're a telehealth provider for women specifically that live in care deserts where they don't have access, either because of bad policy or because there just isn't a gynecologist nearby. They will get connected virtually. Somebody will come by via mobile health clinic, or they will get transported to the nearest facility. There are ways to close these information gaps, these care asymmetries, particularly with regards to women's health. And that's also one of the silver linings, again, of the pandemic, that we didn't have these solutions back in December of 2019.
This is to Chief Diaz. Given the instances of police brutality happening around the country, and your position, given your position, what can Seattle officers do to assure people of color?
You know, it's actually a really good question, and it's actually something that we, are trying to strive to do, to actually be able to be more cognizant and more interaction with communities of color. So we created the SPD before the badge. When you look at international policing, many of them are 1 to 3 years worth of training, and they don't give them a gun. We actually train our officers at the State Academy about 4.5 to 5 months worth of academy, and we give people a gun hoping that we're going to have a better outcome. And that's just not possible. So one of the things that was one of the reasons why I created SPD before the badge, because I wanted our recruits to learn about the communities that we've created trauma in those communities, and how do we better understand how to police in those communities and be more responsive to community needs. So if I hire 100 officers every year for the next 5 years, that's going to be over half this police force that's actually going to change. That's where culture changes. And so we're actually putting people in through a much longer, extensive training than any police department in the country. And so as we start to look at it, 1.5 months in doing that, to 4.5 to 5 months of doing the academy, and then we bring them back for post-plea. We reiterate the values that we really want to instill in our officers and recruits. And then what we've seen over the last, just in my term as the chief, we've actually seen use of force down 48%, just from 2020 to 2021. We've actually seen our complaints drop from around about 1,900 complaints to about 350 this year. And so we're seeing officers complain, actually doing the right thing. And people would say, what is driving that? Maybe officers are not, being responsive to community needs. But we've actually, the markers that I look at that are different, are we making arrests? Are we going out and doing police work? We are actually making almost the same amount of arrests this year on a pace to be on the same pace when we were in 2019, when we had 475 more officers. So officers are going out and making arrests. The second marker that I look at is how many guns we've recovered. We're 30 guns short of the amount of guns that we recovered when we had full staff. So officers are going out and they're recovering guns. They're going out and actually addressing a lot of the violent crime. Then the other piece I look at is are we addressing some of the issues? Are we seeing, when it comes to the narcotics and the fentanyl infesting our community, are we going out and recovering drugs? And we are. And right now, the fentanyl it's a national crisis. It is a national crisis. We're experiencing, just in King County, the most overdose deaths that we've ever experienced. And it's all being driven by fentanyl. And so this is another area that our officers are being responsive to. They're actually going out and recovering fentanyl. They're recovering guns. They're going out and actually seeing a reduction in complaints. They're seeing a reduction in use of force. That is the best case scenario I could possibly have as a chief. There is still more work to be done, but those are the things that I'm constantly trying to evaluate and trying to make sure our department is moving in the right direction.
Thank you. This one's for Dr. Gupta. During the height of the pandemic, we heard all these horror stories about hospital staff having to deal with very long hours and also being very likely to get COVID. How are medical staff doing now after the crisis?
Well, they're not doing good, and what we've seen is about 40% of our healthcare staff is predicted to leave the workforce by the end of the decade. And that's pretty sobering news. Between nurses, physicians, other providers, we don't have enough in the pipeline to replace what we're about to lose, and we're going to have more people to care for. So it's a very difficult set of circumstances right now, exacerbated by the pandemic. There's a lot of reasons for it. One, there's just, I'm sure many of you have heard about the burnout that the pandemic has caused, dissatisfaction. I would say that we need to really think big. Our policymakers at the federal level specifically need to think big about how do we actually incentivize people to go into the medical profession. I know it might sound crazy. Well, gosh, if you go into the medical profession, don't you have a well-off lifestyle in front of you? And it turns out for most cadres within the broader health profession, that's not the case. You have a lot of debt, and things are changing financially. So how do we lessen debt? How do we create more nursing slots? There are not enough nursing slots for those that are interested in the profession of nursing. There are not enough respiratory therapists, frankly. It is absurd in an ICU in a community, much less down the street up First Hill. Often respiratory therapists are the rate-limiting step because we don't have enough of them to provide adequate care for a busy ICU full of vented patients. We need something better. I was deployed on C-17s that were 6 months prior. Were in Kabul doing the evacuation. Actually, one of them, Lewis McChord C-17s, was made famous because we saw a bunch of Afghanis actually climb onto that C-17 and was based at Lewis McChord. That same C-17 was what we were utilizing, that cadre, to transport COVID patients from point A to point B, basically an ICU that couldn't provide requisite care for COVID patients to one that could, moving folks from Tennessee to the Cleveland Clinic as an example. We were leveraging military resources that were deployed downrange to safeguard our healthcare system. It's not sustainable. So we need federal leadership here for debt reduction. We need to incentivize more people to actually want to stay in the health profession. Hazard pay, for example. I got paid hazard pay when I put on a uniform. My nurse got hazard pay, or our team's nurse got hazard pay in uniform. Turns out as a civilian, not the case. It's crazy. There are a lot of things I could go on and on about, but there are ways that we can actually address this issue head on.
Thank you. Well, thank you very much. There's some questions that I didn't get to on my own and also from you, and I'm sorry we don't have the time for that. But I'd like to thank the guests, all of you, for showing up tonight and giving of your time, and thank you, audience members, for being here.